Taskirasi JNIMS ART Sarabasita Maxi TLT Ahumlak Thole Haidi OBC Sina TLT Thokna Bagida Makta Yamna Matiang Panglaga Akoi Lak Minai.
Like Razia and Taskira, there are many mothers and children in Manipur. These are families who have witnessed the best and the worst of living with HIV. At government hospitals, medication and management of HIV is available free of cost. But there are very limited avenues for adolescents with HIV to connect with their peer group. Manipur saw its first HIV case in 1989, and then a spiraling epidemic which claimed a generation of youngsters in the 90s. High HIV prevalence in Manipur has been correlated with a history of injecting drug use and a very difficult geopolitical environment. Initially, the availability and accessibility of HIV services were a challenge, but with NACO and Manipur AIDS Control Society's support, several interventions and service delivery points have now been established. Realizing the absence of an effective system to deliver comprehensive HIV services for adolescents living with HIV, Project Accelerate through the Orphans and Vulnerable Children program, supported by USAID and PEPFAR, established the first Adolescent Friendly Health Center, or AFHC, in Imphal in 2021.
Aduga aina hasabi positive oire habasi khangakpasi chahi manga dom khangale madarna adegi aina hasabe the positive oibasida akoigi imanabi adegi aigi ima idon singna sumaidi aiga samnaningdaba mawongda olpa yam ure adegi aina chaba pot phoba sum haidi chaningdaba.
मेरा मम्मी पापा लोग मुझे थोड़ा नफरत करते हैं कि मैं अकेले HIV एड्स पॉजिटिव है बोल के, इसलिए मैं जब दवाई लेने के लिए बोलता हूँ फार्मेसी से तो मेरा पापा लोग थोड़ा नहीं सुनते मेरा बात.
कनो आइजे एक पोलकपदे सुम HIV पॉजिटिव से ओइरेबको हाइदि पेरेंट्स तगी कनो लाकपनेबा अदो आइनादि खंगदेबा सुंगं फना चावबो सुंगं खंगदे आइजो हिदाक 2016 दगी दुमाइना चाबो हौरेबा 16 चाबो होजे आइजो काइगी दाकनोदि डाइरेक्ट खंगदे अदो कोइ माना सुम एग्जाम खनमने खोनमने हागा सुम चायबा अदुगदि.
So we have set up an adolescent friendly health center, the first of its kind in the country at Imphal, Manipur, at a place called Singzamai. We have selected the place Singzamai because it is at a very strategic location for availing the services for the adolescent living with HIV, and it's located at a radius of within a radius of 3 kilometers from the Pediatric Center of Excellence and all the testing facilities, lab facilities, and also the ICTCs and the medical as well as the non-medical services.
The AFHC offers holistic and comprehensive care. It is planned, executed and strengthened by children and adolescents living with HIV with support from other local stakeholders. This center lets adolescents choose from a number of activities which interest them, and this includes cosmetics, painting, music classes, mixed martial arts training and various other sporting events. This has led to the realization that non-HIV services and other recreational avenues can enhance the access to HIV services. HIV-related services are made accessible through community ART refill groups, peer-led counseling, and other in-house facilities. The center aims to nurture talent, inculcate life skills, and create a safe space for teenagers to be healthy and happy.
When we first go and introduce about our AFHC programs and activities, it's not like it's one day approach that we are explaining. We go to their home, we talk to the caregivers and maybe their father, mother, and then secondly we approach to the child saying that these are the different types of programs that we are having in our AFHC activities.
I do hope that such kind of center, if it is established in other states other than Manipur, it will be very helpful to the people who are really in need of such services. And I want to take up such kind of activities and also if it is included in the annual action plan or with some other funding sources, I think it can be sustained.
In NACO's program, we don't have any program that is specific for the adolescent. But through this project Accelerate, I should say that this program has been a boon, a blessing for the adolescent.
Dauli charise adu isada kemta leite tial di thokpadagi wakhan su nangaire adagi miyam mang thokpu kanda su nokna ade dum wakhal leina dum thoe aina tial di thokpa sida ai thabok toriba NGO sida thabok toriba miyoi na yam nusibi adagi yamna haidi activity aingon yam piwa aduga harauba no khalba loina moina aigi damakta sop towi This
is the first time Manipur has witnessed a program owned and led by adolescents as seen in the vibrancy of Adolescent Friendly Health Center Imphal. The individual case management approach of Accelerate tells us that every child is unique and customized strategies are needed for ART initiation, adherence and retention. So hopefully with the support of NACO, we may develop such models.
The center has been a platform for the LHIVs to interact with their peer partners through various infotainment activities, and also they can give each other advices as well as skill development activities can be performed at the center.
मैं इसको बोलता है कि हम लोग का HIV जो है वो डरने की कोई ज़रूरत नहीं है हम लोग भी जो नॉर्मल आदमी जो कर सकते हैं हम लोग उससे ज़्यादा कर सकते हैं एक दिन तो हम दोनों मिलकर सब सारा वर्ल्ड को बताएंगे कि हम लोग भी कर सकता है बोल के मैं उसको मोटिवेट करता हूँ ये भी मुझे मोटिवेट करता है हम दोनों मिलके ज़रूर एक दिन तो कुछ करके दिखाएंगे
The center, in a span of 1 year, was able to work with 200 adolescents living with HIV, ensuring their adherence and retention on ART. 93% of the adolescents living with HIV are virally suppressed, just like Taskira is today. More importantly, Accelerate's AFHC empowered the adolescents and team to dream big.
Nahaki lai shang nahaki mong fam da dilaring asi